Good afternoon, and welcome to Quality Interactions live discussion of cultural competency and cross-cultural communications. I'm Michele Courton Brown. I'm your host and moderator today, and today's topic is mistrust. What we know today is that mistrust is at an all-time low in America. A recent study right before the pandemic showed that 34% of Americans would rate their trust in the medical community at a high level. That is down from nearly, I think, 75% or 73% in 1966. And while we know that many patients have some concerns or some level of mistrust, those who have historic experiences with the medical community that have not been positive, particularly vulnerable communities, have even greater concerns. And many of those concerns are frankly quite justified. Um, for many on the phone, I know you're familiar with the Tuskegee study that impacted vulnerable populations, particularly African American men, who were not treated for syphilis over their entire lifetimes. And they thought they'd signed up for free governmental care, and in fact, found themselves in a space where they were not being well treated. Um, Also in our history, just a couple of examples, J. Marion Sims, who's often known as the father of gynecology, was well documented to have committed or experimented terribly on young women, mostly enslaved women, as young as age 16, often without anesthesia. And just in 2018, his statue, which was up in New York City Central Park, was taken down. And many of you know the story of Henrietta Lacks. So we have a long history around mistrust. And on the eve of Juneteenth, which is tomorrow, in the midst of our conversations and reckoning around race, around the many conversations that are being had today about gay rights and the recent Supreme Court ruling today, which is a wonderful victory for that community. This is Gay Pride Month. And so just process all of these things happening concurrently, right? And in the midst of this, we had the pandemic, which really held up health disparities. And mistrust is in the middle of that stew. So I'm joined today, as I have been for the last 3 weeks, by my friend and colleague, Dr. Joseph Betancourt. And I'd like to maybe just open up the conversation with how this week has gone for you and how you have experienced mistrust in this pandemic.
Yeah, thanks, Michele, and thanks everyone for tuning in again. We appreciate you being here. It's been quite a week, DACA today got extended for a couple of years too. So we have, we turned, we went south with the transgender protections off civil rights. That was not good news. We got good news yesterday from the Supreme Court, and the DACA thing is good. So there's just I'm reflecting on these times, and it does seem like there's a lot of social revolution happening in different areas. And so I think this past week is a week that hopefully the nation, certainly we here, have tried to move on to action. So we've signaled last week that now it's time to move on to action, and we've spent a lot of time over the course of the week preparing plans, getting them appropriately socialized, board engagement, so all the things that a healthcare system needs to do, and putting ourselves on a very tight timeline for really announcing what we hope will be some substantive changes. I think as I reflect on where we want to go, I think we don't want tokenistic check the box solutions or approaches to racism, certainly. But by the same token, I don't think we want a runway that's indeterminate and aspirations to address racism without some real fixed down payments and some goals, timelines, accountability, and the like. And I think I think fundamentally we're trying to really thread three needles, which is number one, how do we take advantage of the urgency that this moment provides from the standpoint of building in roots of sustainable change. Number two, how do we do it in a participatory fashion so that the people of communities of color raise their voice about what they believe is needed and they're part of the solution, but also that our leadership is part of the solution and they're socialized and engaged appropriately, so participatory. And the third is that how do we create something meaningful, right? So urgency, participatory, and meaningful is really the three driving principles that we're approaching this with this week. And, the mistrust is just one component of a portfolio of things here. And I think, we talked about racism last week, and we talked about kind of things that we need to up our game on, it's racism training, it's implicit bias, it's microaggressions, it's bystander, it's cross-cultural care and communication. But I would also, be remiss if I didn't mention the importance of giving ourselves a better chance to manage mistrust and build trust. And I would say, like a lot of things that we've talked about, that was again laid bare during the pandemic in some very real ways.
So, so how do you think it played out in the pandemic? Do you want to drive a little deeper?
The two big examples that I like to cite are one, what I call the story around masks. Right? So that, I think, we've talked about here before. One of the first things I did early on when, in early March when this hit, in trying to figure out, okay, how are we going to respond? I was trying to figure out, identify some easy wins, and went down and started educating just in groups, nutrition and food services, materials management, environmental services. We did it, we set it up in multiple languages. And this was very, very early on. And those are primarily people of color, limited English proficient. We did it in English, Spanish, Arabic, and Haitian Creole. But, as I've told the story before, we explained to them about COVID. We told them how COVID was easily transmitted, how it was respiratory, how, the importance of social distancing, washing your hands, cleaning surface. We did all that. And so the obvious question for these people was, well, okay, but I'm getting on pretty crowded trains. I'm getting on pretty crowded buses. Like, shouldn't I be wearing a mask? And at that point, we were, the CDC, the Surgeon General and others were saying, no mask, no mask. There's no proof that a mask works. No proof, no proof. We don't want it. And I think part of that was there was still evidence emerging. Part of it was this idea of conservation of PPE. But I would tell people, look, they would ask about masks because it's common sense, right? If you tell me it spreads this way and I'm on top of people in the train, then, so it's common sense. And I would tell them, look, if you have a mask, if you cover yourself, in any way, if you can, I think it's a good idea. But the official guidance was no mask. And of course, 2 weeks later, as the pandemic really kicks up, all of a sudden, everybody's wearing a mask. And now it's like the recommendation is masks. And it's now, like, everywhere's masks. So these individuals now turn to you and say, boy, how come when we were asking about masks, people said no masks? And when it was ravaging our community, people said no masks. And when we were the canary in the coal mine, people said no masks. But now that after we got ravaged, now everybody else gets to wear, is told to wear masks. So that's one. And I think the second real example of mistrust is, we have pushed such a difficult agenda around immigration status and the like, and the rhetoric and all that stuff. And we've always talked about, from a public health standpoint, viruses don't check your papers. They don't, check whether you're insured or uninsured. They don't. And so ultimately, good public health is good public safety, and it's good safety in hospitals if we take care of all of our communities. And certainly, I think one of the big struggles we faced early on is trying to encourage, in a city like Chelsea, where we did a lot of work, individuals who perhaps weren't, legally had documents, to go get tested, to come get care if they needed it. And so a lot of mistrust of government, mistrust of outreach efforts. Like, you're trying to outreach to somebody who's positive, do a symptom check, and they're worried about ICE. We had the National Guard helping with food delivery. What did that mean to people? So mistrust took a lot of different forms during the pandemic that I think really ultimately led to the significant and continued spreading of the virus in those communities. When you're mistrustful, you're like, yeah, I don't trust what they're going to tell me, so they're going to give me more guidelines, and how do I know that they're telling me what I need to do? And so you have to really focus on rebuilding trust. So I think those are two of the examples of where there are ample more, but where the pandemic really unearthed mistrust. I think we talked to one of our earlier chats about the young woman from Massachusetts who in New York who went 3 times with asthma. African American woman didn't get tested. People hear that, right? Did you hear about that black woman who didn't get tested in New York? They don't want to test us. It's mistrust. So anyway, why is there no testing in our community? Is it because perception's reality? Is it because they don't want us to get tested? So all these things played out, I think, in a very real way during COVID.
Well, we have social media now, so those became viral stories, which validated and reinforced the level of mistrust that people have. You did a lot of work in Chelsea. I'm wondering if you could maybe hold up a couple of strategies that you use specifically to improve trust in those in that.
Yeah, and so I think there's 2 streams here, and we've talked about this as well, the importance of a trusted messenger, right? So I say 3. There's 3 issues. I think number 1, acknowledging and you have to have the historical knowledge that there's likely to be mistrust that's putting you at a disadvantage. So that's 1, right? And in Chelsea, we very easily could assume that mistrust was playing a role around immigration. In Mattapan, we could very easily assume that mistrust was playing a role given on all the things you've mentioned. So that's 1. Number 2 is, in the absence of a trusted source of information or trust in general, you turn to, as you say, Facebook, WhatsApp, other mechanisms, the neighbor, and misinformation spreads very quickly, and that becomes information. And so I guess the second key stream is, it's not only knowing, but can you leverage trusted messengers, people who look like the community, come from the community, speak the language of the community. And I think we learned that it doesn't just have to be doctors. We have a lot of employees here who are thought leaders in their community, who work in environmental services, right? How do we promote them, give them flyers about this, promote their thought leadership in their communities, community leaders in their churches, in their environment, to help them help us, right? Because people look at them and say, well, you do work at that hospital, right? So you have that extra information. So it shouldn't just be doctors or nurses. We should really think about valuing all of our employees as trusted messengers in their community. So that's a second one. And I think the third is, we need to empower people who don't look like the community and don't fit the descriptions of everybody I've mentioned kind of in that second pillar, to give them the tools to build trust and let them know that building trust is essential. And I think what ends up happening, especially in a crisis, you do a lot of stuff and you say, well, why don't people show up? Or why are we're putting this stuff there? Because they don't trust you. And all the best laid plans in the absence of trust, don't yield results. And so I guess the third pillar is, how do we teach our colleagues that trust is an issue, that building trust needs to be a key pillar in any intervention in the community, and give them some tools and tactics, in addition to trusted messengers that can help them build trust.
That's a great answer, Joe. One of the things that I was really proud of that you did, among many things during this crisis, is that you spent a lot of time on radio and on television, really communicating this message. And I think the fact that you are multicultural, multilingual, really was a benefit, that you were able to put people at ease because you were able to speak Spanish, that you could relate to them culturally as a person of Puerto Rican descent. And there are times when we can leverage our differences in ways that really accelerate that trust and that relationship. I remember you were interviewed on the local radio station, and the DJ
hip-hop
was
radio station.
Hip-hop station.
That's right. That's the interview. That's the interview that my kids like the most, actually. Yeah.
Very cool at home. But I remember the DJ working through all of your amazing titles and accolades. And at some point in the conversation, you mentioned that you were Puerto Rican, and there was like a break in the conversation, right, where he was like, "Oh, okay, you're like one of mine," right?
Yeah,
and the conversation just took a whole nother sort of dimension because that you were in community in that minute, in that moment.
It's so critical, and that's what trust is. Trust is, we have to be able to use all of our channels and, and communicate, quite frankly, in different ways. I think that's essential to building trust and being available. It's not always going to be perfect. It's not always going to be easy. Right now I do, I don't know if I've mentioned this before, but I grew so weary of trying to, I had great relationships with multicultural media to build that trust in communities. So I could call up El Planeta, call up El Mundo, who were the two of the, call up the Bay State Banner and try to position things. They were very, very helpful. But I said, I'm tired of doing that. What I'm just going to do is 3 days a week, I'm just going to film myself with about a 3 to 5 minute video with an update in Spanish for the community. And Public Affairs pushes it out and it goes out. And I do it now. I cut it back to 2 days a week, but I've covered all types of topics. I covered racism. I covered a bunch of COVID-related topics, but I just covered the census, voting. So I think nowadays, as you mentioned, with technology, you don't need to wait for a radio station. You could kind of be your own voice, trusted voice there. So that's a key essential part of building trust.
So talk to us about the role that training can play in mitigating this issue of mistrust. Because one of the issues that stands out is that it's not just that when people show up at the doctor's office that they mistrust health professionals, but sometimes people don't actually go into the doctor's office at all because
Yeah, and we'll be talking about that next week around reopening, because there's a whole portfolio of how all these things play out as we call people back to us. You're right. I mean, I think ultimately this plays out in a whole bunch of different ways. And so when you think about, we've been talking about mistrust for a long time. Right now, with this crisis, we have a reckoning, right? There's a lot of people who are very interested in kind of, getting more educated around all issues related to race, understanding history more. And I think this will be an opportunity for a lot of our peers to better understand the roots of this mistrust, right? So if I'm in an organization, I think number one, helping educate, giving resources to help educate my other leaders who don't fully understand this around, J. Marion Sims, Henrietta Lacks, the ski syphilis, the list goes on. Those are just a few of examples that have happened in multiple communities. Because this community likes evidence, right? So you present them with evidence and facts. I think that's an important part of that. But we've talked a lot about opportunities for organizations to build trust and also individuals to build trust. And I think, clearly on the training side, it's incredibly helpful because this is a onesie, twosie deal. It is, because ultimately I believe organizations need to do a couple of things. They need to acknowledge that mistrust exists. And so they're thinking about it first and foremost on the organizational side. I think that organizations also need to be invested in building relationships and put trust first, right? And understand how trust plays out in different communities for the reasons we mentioned. But on the individual side, we've done a lot of training over the years talking about some key tools, practical and actionable, right? So being able to, when I see a patient and I'm getting to know them, asking them, have you ever had a bad healthcare experience I should know about? And can you share that with me in a couple of minutes? And of course, everybody has bad experiences, but ultimately it becomes a very, I think, sharp radar for when people have, mistrust based on race or ethnicity or language. Their stories oftentimes lock into that. And the importance of giving that space is that an investment in trust is an investment in a long-term therapeutic, healing and therapeutic relationship. You can have all the technology, technical and medical knowledge in your mind. If you don't have trust, you don't have anything. Right? And so this idea of asking a patient, that often what it reveals is some story. My last doctor used to draw all these blood tests. They never sent me a letter, and I don't know what that was about. And maybe they were perceptions, reality. Maybe they were hiding something from me. And so this gives you a chance to do a couple things. It gives you a chance to say, I'm sorry. I can't explain why that happened. Number two, this is how I will get you that information, whatever, or this is how I will address that issue for you. And number three, if you have any concerns like that, please let me know. I want you to trust me. So what it does is it creates a moment of vulnerability, right? And it's a moment that you're able to apologize, even if you've done nothing to engender mistrust, but apologize just for everything that's been done. And this, people talk about apologies. What do I need? I didn't do anything. What do I need to apologize for? It's not. I'm not apologizing for me. I'm just apologizing apologizing for the fact that you've had a bad experience, and I'm sorry that somebody's treated you in a way that's not dignified or respectful. But those are the three things that I think we focus on our training. And the great thing about that is that research demonstrates that person can still be mistrustful of this hospital. They can still be mistrustful of a lot of different things but you have the opportunity to build trust despite a lot of mistrust. So in a web of mistrust, so in those minutes, you're not going to, knock down the entire web, but you've pulled out one stitch of that web. And that's the stitch that's most important to you, because that's a stitch where you're engaging. And so I think, clearly training in this area is going to be more important now than ever before. People are, scarred yet again. This latest issue that is reared racism's ugly head yet again is reinforcing all of this yet again. And so I think investments in trust and building trust are really, really going to be essential here.
I totally agree. I every week we try to at least hold up one participant question. So I'm going to do that right now. And the question is, how can white healthcare workers address the accumulation of trauma in their clients of color without adding to their trauma or expecting them to educate us about their needs?
Yeah, this is really, this is a very complicated thing right now, because there is no good blueprint, just to be clear, from Black people or people of color to white people right now. There's a spectrum. And what I'm trying to tell people is, I know it's not easy, but you have to understand it. When you experience and live so much injustice, some people are going to be angry, some people are going to be resentful, some people are going to be sad, some people are going to be frustrated, and some people are going to say, don't ask me how I'm doing if you really don't care. Other people are going to say, nobody asked me how I'm doing. Some people are going to say, this isn't my problem to solve, this is white people's problem to solve. Some people are going to say, I want to be at the table because I want to inform the solution, right? And what I'm trying to share with people on both sides, both people of color and white people, is, can we, and it's not easy, and yes, as people of color, we carry this burden. It's a burden that we carry. There's no doubt. There's no doubt that it is not easy. And, like people say, well, I got to spend time educating. I know it. It's hard work. But you know what? People have laid down their lives for this cause. So you always got to look at it relatively speaking, right? It's exhausting. I understand it. But it's the cross we bear for justice, right? It's the cross that we bear to try to bend that moral arc of the universe towards justice. That's what it requires of us. So I guess all I would say is, I'm telling my white peers who are walking on eggshells right now, they're not sure what to say, how to say, when to say it, to say simply, you know what? If you just engage with humility and say, look, I want to do better, I care, I won't be perfect, I don't have the answers. If there's ways in which you could help guide me, I'm happy to put my best foot forward, but I care. And I'm sorry that you've gone through this, and I know I'll never understand it. But like, if you engage with some humility, you give yourself a fighting chance, I believe. I think people can engage with that humanity. And you also got to be prepared to manage a whole series of emotions. And so, it is, I think it is not right to just say, hey, educate me. But I think this is going to require that we all are able to communicate. And it's going to be about our common humanity. And if we put up too many walls, it's going to be a problem. And I know that, people of color say, well, I'm tired. And, this wall is there because I can't anymore. I don't have an easy answer. And everybody needs to take care of themselves, and everybody has their own thermostat on this. So you engage if you can engage, and if you can't, you pull yourself out. But I think this is part of what I would say to that question, and also it's how we learn from each other, and this is the benefit of training, right? Because I don't have to carry that burden from a 1, 2, 3 person basis. There's a way we could at least inoculate a lot of people with a standard bit of information, and then they are better prepared, hopefully, for these blended learning and these conversations.
Absolutely. It creates a foundation and some common language through training that allows for those authentic conversations to be had.
Yeah.
We're coming up close to the end of the hour. I just wondered if you had any final comments, but I actually think what you just shared about being vulnerable, about being open, about trying to maintain the stamina necessary as people of color to stay in the struggle, as we have these difficult and uncomfortable conversations. I would just also add that it may be okay to be uncomfortable for a minute or two.
Yeah.
But
Yeah.
this is 400 years in the making,
Yeah.
and it's going to take us a while to unbundle. But I think that we're ripe for these conversations. And I think in the right circumstances with the right training, we're creating spaces for real progress to happen.
Yeah, yeah. No, I think that's right. And again, I want to reiterate, like, I'm giving my, I'm deeply dedicated to this work. Uh, and I share my thoughts with all humility and with the full acknowledgement that I don't walk around this world with black skin. So I understand that I'm sharing these perspectives and trying to give voice to a lot of people and a lot of different perspectives. So this is one, and it's one that I hear from my people who do live with black skin and who do live this every day. And that's that's what motivates this work in so many ways for me, and has always motivated that work for me. So I think it is. We need to create that discomfort. We need to challenge people to say anything you create that doesn't make you uncomfortable was not good enough. And we need to really leverage this moment. And I thank people for joining us again. And I guess next week we'll be talking about all these issues as they relate to reopening and everything that's happening around the country. So thank you all.
Thank you. It's a great close, Joe. Thanks so much. We'll see you next week. Have a good day.
Bye-bye.